Welcome to this brief introduction to patient-centeredness and PCMH recognition. Patient-centered care is a proven method for providing comprehensive, whole-person care and improving and sustaining quality standards for organizing care around patients, working in teams within the practice, comprehensively coordinating patient care, and tracking care over time. It is the American College of Physicians' position that a monthly care coordination payment or bundled care coordination fee that is risk-adjusted and reflective of the practice's service capability based on the PCMH recognition process for the physician and non-physician work that falls outside of a face-to-face visit and for the system infrastructure needed to achieve better outcomes. The College recommends that Medicare and other healthcare payers implement changes to support a new model of service delivery with related risk-adjusted prospective payments for ambulatory care that uses systems that promote patient-centered, longitudinal, coordinated care, the PCMH model. This new model would apply to physicians and practices that have demonstrated key attributes necessary to manage care consistent with this approach and would take into account the increased work and resources associated with providing this model of care. PCMH's proactive mode continually manages patients' needs in lieu of the normal reactive pattern of care delivery. There are 3 levels of recognition that practices may be awarded. In each, practices must demonstrate proficiency in 6 must-pass elements and achieve points or partial points cumulatively required to attain the correlating recognition level. The 6 standards are composed of measures relative to enhanced access and continuity, managing patient populations, preventative care and disease management, care coordination and tracking, self-care support and community resources, care planning, integrating behavioral health models, and measuring and improving performance. For many, the process may seem overwhelming, and while it takes time and effort, all practices dedicated to patient-centeredness and integrating the medical home model can obtain PCMH recognition. The patient-centered medical home model is becoming widely acknowledged as key to healthcare reform. By 2011, more than 7,600 practitioners at more than 1,500 locations across the country have achieved PCMH recognition through the National Committee for Quality Assurance, and that program is just one of 4 national medical home recognition programs. It estimates that the numbers have possibly risen by 400% since. Identified as fundamental to the drive for comprehensive, quality health care for all, although now an international movement, nationally efforts are underway to ensure all providers are patient-centered medical homes. The patient-centered medical home is becoming a centerpiece of national efforts to reform U.S. healthcare and to improve the value of primary care. It addresses gaps in quality care and high healthcare costs. It also has been shown that when adults have a medical home and health insurance, racial and ethnic disparities in access and quality are reduced or even eliminated. Characteristics of the PCMH model are composed of joint principles developed by the AFP, ACP, AAP, AOA, the Joint Commission, and URAC. Principles start with personal physician or clinician that delivers proactive, comprehensive care for all patients in an accessible fashion and in a physician-directed practice that is trained to work as a team and looks to the whole person, making sure their care is high quality, safe, and coordinated. Team-integrated resources and interventions are implemented to provide best possible outcomes with reimbursement commensurate with the practice's demonstration of patient-centeredness. There are countless reasons to seek PCMH recognition. We have chosen what we believe are the top 10. Enhanced patient care resulting in national reports of better care quality, evidenced by improved disease management, improved access, significantly reduced morbidity rates, reported better work environment, lower care costs, and reduction in ER and inpatient costs. Healthcare practices and their individual eligible clinicians recognized as patient-centered medical homes are listed on the NCQA website and available to the industry as well as the public. The industry has taken on the cause of educating the public about the patient-centered medical home. Insurers have started to follow suit. Now insurers are identifying PCMHs on the provider directories for patients searching for providers and clinicians in search of patient referrals. In turn, most insurers have developed a reimbursement program based on PCMH recognition, as we've seen suggested by the American College of Physicians, among other industry leaders. The ACA legislation, due for full implementation in 2014, is intended to improve the quality of healthcare and overall health of the general population, with which the PCMH model is fully aligned. This model provides added structure for community health center expansion. It also corresponds completely with meaningful use, along with new and existing benchmarks, enabling practices to streamline quality management efforts. ACOs will also find they are positioned for compliance under the Affordable Care Act. PCMH satisfaction reports evidence improvement in patient experience, and CMH patients report feeling a sense of advocacy on their behalf, helping them navigate a fragmented health system. Presented by Dr. Gregory Herman, one of South Jersey's top physicians, the PCMH Recognition Simplified Seminar is designed to appraise the fundamental characteristics of a patient-centered medical home, help simplify the recognition process, and identify key principles necessary for sustaining patient-centeredness. The PCMH Recognition Simplified Seminar is designed for physicians, physician's assistants, nurse practitioners, nurse managers, quality managers, office managers, and all PCMH coordinators and key team members with practices who have interest in becoming a patient-centered medical home immediately or adopting the model to improve the practice's functionality and in anticipation of future recognition. Have already begun the survey process and would like to gain clarity on the policies, standards, and documentation to help improve their outcome. Have gained PCMH recognition but would like to improve their score and recognition level. Are up for renewal or diligent in efforts to sustain patient-centeredness and need refreshers for clinicians and staff. When speaking with providers about PCMH, 3 questions frequently arise. How can PCMH recognition help improve reimbursement rates? Does a practice need to have electronic health records to qualify for PCMH recognition? And does the seminar discuss meaningful use and how it relates to PCMH? Once recognized, participating third-party payers are made aware of your recognition status. Some payers offer increased rates for recognition alone, where others may consider the practice eligible to apply for pay-for-performance certification. Also, practices may use this PCMH recognition status as leverage for requesting higher reimbursement from participating third-party payers. Practices can and have successfully achieved PCMH recognition without electronic health record. The seminar reviews all factors of every element, including how the PCMH standards correlate to meaningful use. PCMH is a team approach to care led by a primary care physician. It provides a central point of access to healthcare professionals, medical records, and complementary care. PCMH endeavors to increase shared responsibility across the healthcare team. Facilitating self-management is also a critical component of the medical home, empowering patients and providing them with skills necessary for self-management and healthy living. The primary care physician or clinician cannot manage patients' care solely. The PCMH model involves teamwork between patients, their personal clinician, their healthcare team, and when appropriate, the patient's family. Employing the team approach to care enables the clinician to focus on managing the patient's health and restoring patient relationships, fostering patient collaboration and patient involvement in self-management. The seminar is presented by Dr. Gregory Herman, a premier South Jersey primary care physician. Dr. Herman holds positions as Inspire Health Networks, formerly South Jersey Healthcare and Underwood Memorial Hospitals, Family Medicine Residency Director, and Chief Medical Information Officer. Among several other affiliations, Dr. Herman is a member of the American Academy of Family Physicians and the Association of Medical Directors of Information Systems. The goals of the seminar are to discuss the PCMH recognition survey and processes, review scoring methods, and discuss application fee schedules. Review eligibility requirements, corporate tool submissions, and review the application process. Analyze in depth the PCMH recognition standards, examine documentation requirements, provide attendees with supporting documentation, resources, and other instructions for accessing necessary and optional resources. Participants enjoy meals and program manual complete with standards further clarified for ease of application. Questions are welcomed and encouraged throughout the program. Attendees are provided instructions for accessing additional necessary and optional resources, along with contacts for interactive communication and information source. Additionally, attendees receive a complimentary online profile and listing in Attendee Directory. Join us on November 15th at the new Courtyard by the Marriott for a day of learning, networking, and meeting of great minds. Seats are limited, but we'd really love to see you there.